Our OPD process is streamlined for both new and follow-up cases. Upon arrival, patients receive a token and an updated OPD card along with the discharge summary. These documents are shown at reception and an entry is made in the OPD register. Patients are guided for anthropometry, where we take baseline measurements such as weight, height, head circumference, and vital signs. This data is compared with the previous records and noted on their card. Next, we visit the OPD room for a detailed examination, where parental concerns are addressed and necessary interventions with referrals are recommended. At the OPD, growth assessment, medication, immunization history, and treatment prescriptions are done. At our center, we are committed to providing comprehensive and compassionate oral care to every patient who walks through our doors. The dental setup is designed with young patients in mind, featuring a specially designed car dental chair that's both fun and comfortable to help child feel at ease. To further create a relaxed environment, we have a wall-mounted TV screen that provides entertainment, keeping kids distracted and engaged during their treatment. Additionally, we are fully equipped with the latest dental technology and materials, ensuring that every treatment is performed with the highest standards of care and precision. We begin with a detailed oral examination to assess the overall health of your teeth and gums. For new mothers, we provide personalized counseling on maintaining oral hygiene for both themselves and their babies. One of the cornerstones of oral health is proper brushing technique. Fluoride varnish is an effective treatment to help strengthen teeth and prevent cavities. We routinely apply fluoride to all patients who need it, tailored to their individual dental needs. After the examination, we develop a customized treatment plan to address any concern and ensure optimal oral health. Whether it's preventive care or restorative treatment, maintaining oral health is an ongoing process. That's why we follow up with our patient every 3 months to monitor progress, provide continued care, and address any new concern. We have a specialized sterilization room located next to the dental OPD, where all used instruments undergo a thorough process. Initially, the instruments are soaked, cleaned, and washed to remove any contaminants. After cleaning, they are carefully sealed in pouches, packed securely, and then subjected to autoclaving for complete sterilization, ensuring the highest standards of hygiene and safety. Psychological evaluation in neonates play a vital role in promoting healthy development. By assessing the developmental trajectory, we help in identifying the cognitive gaps. Our screening process begins at first month of age by using Bailey's developmental assessment, followed by a regular follow-ups every 3 months to track the progress. For children over 3.6 years, we use the Winland Social Maturity Scale and WPPSI to assess social and intelligence quotients. If typical signs are observed, for further assessment, such as MCHAT, CARS, and ISA, are conducted to rule out autism, ADHD, and other developmental disorders. After initial assessment, we now move on to counseling and psychotherapy, where we help parents and caregivers broaden their awareness and perspective through psychoeducation of disorders and developmental delays. Fostering a safe environment for children and families help them to provide intervention in session and guidance for home-based care. Physiotherapists play a crucial role in screening for movement and tone abnormalities in patients from birth to 6 years of age. For children with diagnosed neuromotor impairments, a comprehensive approach to development is crucial. This involves a detailed assessment of functional abilities, followed by specific interventions designed to enhance balance, stability, and independence. Home-based therapy plays a vital role in the holistic development of these children. It ensures the continuation of therapeutic practices throughout the day, with professionals coaching parents to perform activities that significantly enhance development. This approach integrates vision, hearing, cognition, and motor skills to promote overall growth. Developmental supportive care in the NICU is delivered by a team of therapists from the MEIC who regularly visit the NICU to monitor the postures of infant receiving medical care. It includes nesting with a specially designed bed linens, maintaining head and trunk aligned in a straight line with arms on chest and legs flexed to ensure sleep, physiological stability, early breastfeeding, and provide confidence to the mother in handling. Occupational therapist addresses sensory issues from birth till 6 years of age with neurodevelopmental disorders. They play a crucial part in helping premature and critically ill infants in the NICU by providing multisensory stimulation. The types of multisensory stimulation include tactile stimulation, visual stimulation, auditory stimulation, vestibular stimulation, olfactory stimulation, and oral stimulation. But the work of occupational therapists doesn't stop here. They also support children with neurodevelopmental disorders such as autism spectrum disorder, attention deficit hyperactivity disorder, and sensory processing disorders. At MEIC, we offer comprehensive vision screening, assessment, and rehabilitation services. In our vision diagnostic room, newborn vision screening begins with a red reflex test using a direct ophthalmoscope. This helps us observe the retina's color, which should appear red. Any abnormality such as pale yellow, white reflex, or no reflex are noticed as a part of primary health checkup for the newborn. We also measure intraocular pressure with a handheld tonometer to rule out hypo or hyperocular tension. Fundus photography using Trinetra Neo is then performed to detect retinal abnormalities like ROP, hemorrhages, coloboma, and retinitis pigmentosa. In our vision assessment room, we evaluate children up to 6 years old for refraction and squint workup. Vision assessment is done according to the age of child, utilizing tools like LIA paddles, Cardiff, Equity cards, and Teller's cards. We also use a Snellen's chart with LED for measuring visual acuity, helping us to assess a child's ability to identify letters, symbols, or shapes. Based on the assessment result, we determine the refractive status and decide whether the corrective glasses are necessary. For children with mild refractive errors detected at the community camp, we follow up them at our OPD. We also educate parents and children about the risk of excessive digital usage, a leading cause of refractive errors in young children. For children with visual impairment, vision rehabilitation and stimulation are essential for enhancing their functional abilities and fostering independence. We provide rehabilitation and stimulation for children with CVI or other syndromes. The Audiology unit at Model Early Intervention Center aims to assess the auditory skills of all neonates through a comprehensive test battery. The unit follows the RBSK operational guidelines to screen each neonate just 24 hours after birth or at the time of discharge for any hearing disability. The screening is done through behavioral as well as physiological tests for all neonates through BERA and OAE. The neonates are checked for any visible birth defect which can potentially lead to hearing loss. Neonates admitted in the NICU have high risk for hearing loss, such as hyperbilirubinemia, low birth weight, birth asphyxia, aspiration of amniotic fluid, delayed birth cry, abnormal Apgar score, etc. and thus are also screened with electrophysiological screening test, that is automated auditory brainstem responses, which assesses the hearing pathway till the level of brainstem. A detailed comprehensive diagnostic evaluation is followed if there is a negative result in any of the screening tests, which will include impedance audiometry to check the middle ear status and rule out any conductive pathology such as middle ear infection, etc. BERA is used to track the hearing threshold to each ear separately and decide on the management strategy accordingly. High-risk neonates are followed up every 3 to 6 months for hearing evaluation to rule out progressive late-onset hearing loss. For older children, the diagnostic test battery involves VRA for children in range of 6 to 24 months, and for children older than 24 months, condition play audiometry is used. Neurophysiological tests such as EEG, VP, NCV and EMG play a crucial role in early intervention centers, particularly for children with developmental concerns or neurological impairments. In a dark, silent neurophysiology lab, amplitude EEG is performed on a preterm infant to assess age-appropriate brain maturation and detect abnormalities, with a video recording to correlate neural activity with the behavior. VEP evaluates optic nerve maturation in preterm infants by recording neural responses to red flash stimuli identifying abnormalities. NCS measures nerve conduction speed and EMG analyzes muscle activity, helping detect early nerve and muscle issues for timely intervention. Neonatal heart screening using electrocardiogram is essential for the early detection of cardiovascular diseases. This non-invasive and painless diagnostic tool is easy to perform on newborns. We use limb electrodes with alligator clips to capture the heart's electrical activity for early identification of potential heart issues. At MEIC, we understand that the medical procedures can be distressing for the children, especially when it involves needles and syringes. To make these procedures less intimidating, we use several child-free strategies. For newborns, pacifiers are used to provide comfort, while the presence of parents help to calm the child. To facilitate quick processing and providing the report same day, we use hematology analyzer and biochemistry analyzer for routine blood tests. Common procedures such as sample collection, drug administration, nebulization, suctioning and dressing are carried out with great care in our procedure room. We are also well prepared for emergencies with a fully equipped crash cart and 2 oxygen cylinders along with emergency drugs and equipment, ensuring a swift response to any unforeseen events. At MEIC, we run a specialized weekly outpatient clinic under the guidance of our expert orthopedic surgeon to consult all congenital as well as acquired musculoskeletal conditions, including pediatric foot and ankle conditions, pediatric knee conditions, pediatric hip conditions, upper limb anomalies, musculoskeletal infections, post-traumatic limb deformities, musculoskeletal oncology. The most common treated condition here is the clubfoot with Ponseti casting. The congenital talipes equinovarus is one of the most common congenital malformation, affecting 1 in per 1,000 live births in India. The Ponseti technique remains the gold standard for its treatment, involving 2 key phases: serial casting and maintaining correction. Although Ponseti casting is highly effective, the process of weekly cast removals can be intimidating for both the child and the caregiver. The sound of the cast saw and the sight of the blade can be frightening, with the added risk of potential cast saw injuries. To ease this experience, we have designed a unique child-friendly environment. The ceiling is decorated with the solar system theme to engage and distract the child. The child sits comfortably in a specially designed bathtub with the mother beside him. Instead of using cast saw right away, we begin by soaking the plaster cast in lukewarm water. This cost-effective and simple method softens the plaster, making the removal process safer and more comfortable. The basin of lukewarm water is placed at the foot end of the child. The cast is soaked until the outer layer softens, hence loosening the plaster. The leading edge is carefully cut using a surgical blade, and then the cast is gently unwrapped. This process typically takes 15 to 20 minutes, and our experience with it has been extremely positive. There has been no failures or injuries, and the child remains comfortable throughout the procedure. After the cast removal, the child's limb is gently cleaned and the next cast is applied. This innovative approach brings us closer to offering a safer and a more comfortable experience. Our center has a prosthetic and an orthotic lab. The technician plays a crucial role in the early intervention healthcare team, addressing congenital anomalies, developmental issues, birth injuries, and various neurological and muscular conditions. In our lab, we begin by thoroughly evaluating each patient based on their specific needs. We then provide supportive, assistive, and positioning devices designed to support, correct, and prevent deformities such as tightness or contractures. We provide tailored solutions for each patient. Documentation is a vital part of the treatment. There is a saying, if you didn't document, you didn't do it. In MEIC, we have a provision for written and digital record keeping. For our high-risk newborns and ones who were discharged from NICU, we maintain handwritten notes in 5 separate registers, each dedicated for each day and each group. For digital record keeping, our data is uploaded to Drive in folders, segregated yearly, monthly, weekly, daily, based on birth weight and OPD follow-up day. This helps in easy access to patients' detailed medical data, even in case of missing files and reports from the patient's end. Beyond OPD, we extend our services in weekly camps, which are held in local communities in and around the district. The school-going Anganwadi children are screened at the camp and are called for a detailed evaluation if any refer results are obtained at the time of evaluation. Community camps are organized by MEIC team every Saturday as per the availability in Anganwadi, PHCs or schools. They are assessed for awareness on developmental milestones, community health status assessment, and early diagnosis and interventions. The camp covers the following health parameters: anthropometric assessment, general physical evaluation, oral health checkups, physical and occupational screening, psychological assessment and counseling, vision and hearing screening. The cases which need further evaluation and treatment are called to MEIC throughout the week to provide timely treatment and intervention. We began our journey with a very small team, and today our center is proud to have a dedicated team of over 35 staff members from diverse medical and allied medical fields, working together seamlessly to deliver the best possible care and support. To wrap up, I would leave you with a thought from Dr. Jerome Bruner, a renowned cognitive psychologist. The earlier you intervene, the more effective the intervention is. Thank you for being an integral part of this meaningful and beautiful journey. Thank you.